What can your physical exam tell me about mental health? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I'm a metabolic psychiatrist, meaning that I look at the overlap between mental health and metabolic health. So first, let's start with vitals. Generally, we want your blood pressure to be less than 130 over 80. Of course, depending on age, that range can vary. If you have multiple blood pressure readings, both in the clinic and at home, that are over 130 over 80, then that would indicate a diagnosis of hypertension, which is a marker of metabolic dysfunction. Although we say that a normal pulse is between 60 and 100, we know that the higher the pulse, the more likely there is to be some metabolic dysfunction going on. Basically, your heart has to work harder to maintain what someone who's only beating 60 minutes per minute can maintain. And then what about measurements, height, weight, etc. So BMI is not the best indicator of whether or not someone's healthy because it doesn't take into account your lean muscle mass, etc. What I'm looking at more so is, one, has there been weight gain or weight loss recently? But two, I'm going to look at central adiposity, meaning is this person carrying their weight in their midsection? Now, why do I look at that? Because we know that if your waist to height ratio is greater than 0.5, that is a positive screen for insulin resistance. It's not diagnostic, but it does mean that you have an increased chance of insulin resistance, especially if that's something that has developed over time. Other things I'm going to look at: your skin. Is there evidence of inflammation? Is there rosacea, eczema, psoriasis? Or do I notice skin darkening or a lot of skin tags? The skin tags and skin darkening is a sign of insulin resistance because insulin is a growth hormone, and so it's leading to overproduction of skin cells. I'm also going to listen to how they sound. Do they sound like they have heavy breathing at baseline? This could be indicative of sleep apnea. I'm going to look at the tone of their skin. Are they really pale? Am I concerned that maybe this person has iron deficiency anemia? I'm going to look at their skin and their lips and their eyes to see if there's evidence of dehydration. If someone has a yellowing of the eyes and skin, then we call this jaundice, and that is usually indicative of pretty advanced liver disease. And I'm also going to look at their overall body movements. Are they having a tremor? Do they have uncontrolled jerking of their muscles? Do they have a steady gait? These things are all going to tell me something about their neurologic functioning, as well as if there may be side effects from the medication going on. I'm going to look at their dentition. That's going to be an indicator to me of how well they're able to care for themselves. I'm going to smell what they smell like. Again, an indicator of how well they're taking care of themselves. Or maybe if there's some underlying yeast or other infection going on. I'm going to look at if there's general puffiness or edema. This could mean that there's a heart issue going on that's leading them to retain fluid, or maybe they have thyroid issues. And along those lines, I'm going to look at their hair. Is there thinning of hair, which is, of course, in some cases age appropriate, but in other cases, it's going to be indicative of either a vitamin deficiency or some underlying hormonal issue, maybe thyroid or cortisol. I'm going to look at their nails. Have they chewed them down to a stub? And I'm going to look to see if they're kind of carrying weight in their upper back, kind of like a hunchback. I know that's a terrible way to describe it, but if that's the case, then that could be indicative of an issue with cortisol again. So these are all things that I'm observing as I see a patient, and it may point me in the direction of, oh, we need to order these certain labs to see if something is going on that's affecting their metabolism. What do you think? Is there anything that I've missed here that someone's physical appearance or exam might indicate about their mental health? If you have something, feel free to share it in the comments below. Wishing you all good mental health today, and I'll see you in the next one.